I work as a community mental health nurse. I've been involved in a project where we were implementing a positive behavioural support model on a ward. The way we did it was to encourage collaboration between the patients and the patients on the ward. We were able then to share the wealth of knowledge, not only from the staff but also the patients, around how that model was best implemented. I feel like the project I've been involved with has made a difference because we've had lots of positive feedback from the patients and from other staff, but also the work has been shared with wider audiences at conferences and had a lot of positive feedback there. And for me, what's most important about that is that the voices of those at most disadvantage have been heard very loudly and has hopefully made a difference in lots of areas where people have from other areas and other parts of the country have taken an interest in the project and are going to be replicating some of that stuff themselves.
I'm Firdaus Edelwala. I'm a consultant geriatrician working in Newport Talbot, and this is Annette Davis, who is a district nurse by background and now a lead advanced nurse practitioner in the acute clinical team in Newport Talbot. We started this service nearly 12-13 years ago. It was initially a small service based in the community, and the main aim of the service was to try and provide better care for the people living in the community, especially for the older, frail person. The service has gradually grown over the years, and from a team of about 4 or 5, it's now more than 20.
We know we're making a difference in our role because our aim is to provide better care in the community, and we know we're doing this because we've had positive friends and family feedback from the Welsh Ambulance Service, from secondary care colleagues and from our GPs. We've reduced hospital admissions in the last 6 to 7 years, and we've broken down barriers between primary care services and between primary care and secondary care services.
I'm Sharon Morris. I'm a Senior Chief Clinical Physiologist at the Cardiorespiratory Department in Singleton Hospital. I was asked to set up a paediatric echo service in 1993. I spent some time in Cardiff getting all the necessary skills, and the service has now grown considerably. I scan a large age range going from the newborn up to adulthood to the adult congenital clinic. I know I'm making a difference in my role in the work that I do, basically based on the feedback that I get from the children and the parents and also from the medical staff. I've been really fortunate to see a lot of children grow up from scanning them when they're a baby to adulthood.